Today I'm going to be talking about osteoarthritis in cats, which is a common but often misunderstood condition that affects the skeletal system, particularly the joints. So whether you've noticed stiffness in your cat or you're simply here to learn, this video should help you understand what's going on or inside your cat's body and what signs to watch out for. So, osteoarthritis, which is often abbreviated as OA, is a chronic and progressive joint disease. The term osteo means bone, and arthro means joints, and itis means inflammation. So, this osteoarthritis literally means inflammation to the bones and joints. This condition leads to the degeneration or lysis of cartilage, which is the smooth tissue that cushions joints, and over time the bones may rub against each other, leading to pain, stiffness, and reduced mobility. So over here you can kind of see the differences in a normal cat's elbow versus an arthritic elbow, as well as a normal knee and an arthritic knee. So where does OA happen? So OA can affect any synovial joint in a cat's body, but it is most commonly show up in the hips, stifles, which are the knees, elbows, and intervertebral joints of the spine. So these joints are found along the axial and the appendicular skeleton. For orientation, the cranial direction refers to the head end, while caudal is towards the tail. Joints like the hip are caudal while the elbow is more cranial, so understanding this will help us identify where discomfort might be coming from when a cat starts changing its behavior. And this is just a diagram of where the red is showing that is really the points where the arthritis is. So osteoarthritis in cats is chronic, which means it develops over time and it doesn't go away. So it's not just a problem of old age. So this means that younger cats can also develop OA due to trauma or joint abnormalities. So unfortunately, OA in felines is often overlooked because cats are just really good at hiding pain. So it makes it harder for you to find what the problem is. But that doesn't mean that they aren't suffering. So discussing this condition is crucial because early diagnosis and orthopedic care can help improve your cat's quality of life significantly. And studies have shown that up to 90% of cats over the age of 12 can develop OA. So clinical signs to watch for, instead of obvious limping, cats with OA tend to show subtle behavior changes. So these can include the less willingness to jump or climb, stiffness, especially after rest, changes in grooming, particularly over the back or epaxial muscles, atrophy of limb muscles from disuse, and irritability when touched, especially near affected joints. And you may also notice a reduction in flexion and extension of the joints, or trouble adducting or abducting a limb, which means moving it toward or away from the body. So inflammation and pathology. So OA involves aseptic inflammation, which means there's no infection, but there is swelling, pain, as well as heat in the joint. So the synovial membrane becomes irritated, which is producing excess fluid and causing visible joint swelling. So sometimes cats can develop small osteophytes or bony growths on joint surfaces, and over time inflammation can also cause hypertrophy of surrounding tissue or intramuscular tension due to compensatory movement. How is it diagnosed? So there are a few ways that it can be diagnosed. So this can start with a physical exam and a good history of how your cat moves, how they behave or react to touch. Vets often recommend radiographs, which are x-rays, to look for invertebral space narrowing, joint deformities, or signs of diaphyseal or epiphyseal irregularities. Transverse or oblique radiographic views can show bone on bone contact or even bone spurs. So, advanced imaging like arthroscopy, which is using a small camera inside the joint, can also provide even more detail and see if your cat really does have OA. So, what can you do specifically? While OA can't be cured, it can be managed. So, treatment often includes weight control to reduce joint stress, pain relief medications, joint supplements like glucosamine, I think that's how it's pronounced, some physical therapy to maintain range and motion, and in some cases, intra-articular injections or surgeries. So, caring for a cat with OA means creating an environment that supports comfort, low entry litter boxes, padded bedding, and as well as easy access to food and water, which are great starting points. And these are my references. Thank you.